Good morning. I am Nichelle Mullins, the President and CEO of Charter Oak Health Center, and I stand next to United States Senator Richard Blumenthal. Thank you all for coming this morning, and thank you, Senator Blumenthal, for convening this press conference to talk about funding for the COVID-19 vaccine distribution. I just want to give you a quick background. Charter Oak Health Center and the other federally qualified health centers in the state of Connecticut have been providing access to COVID-19 testing since the very early stages of the pandemic. Charter Oak Health Center has performed over 12,000 tests to date within Hartford, Windsor, Bloomfield, and some of the surrounding suburbs in the state. We are working very closely with the Department of Public Health, with the Department of Social Services, with the Governor's Office, and with the Office of Policy Management to ensure that access to testing is equitable and statewide. I also have the pleasure of having been recently appointed to Governor Lamont's Vaccine Advisory Group for the state, and I have also been appointed as co-chair of the allocation subcommittee for the vaccine. So far, the Vaccine Advisory Group has met twice, and we will be providing preliminary recommendations, hopefully, regarding Phase 1A allocation of the vaccine to the governor by late December. And this is just in time, as we've heard, that ACIP will be convening, and the FDA will be convening actually on December 10th to review Pfizer's request for emergency use authorization of their vaccine. So we are very committed to providing access to testing. We are very committed to providing equitable access to the vaccine as well once it becomes available. And I just want to continue to underscore the importance for federal funding so that the testing and the vaccine, when it becomes available, is made widely available to not just the residents of the state of Connecticut, but also nationwide. And so in closing, I just want to remind everyone to continue to practice social distancing. We are seeing a marked rise in the number of positive cases. Have a happy and safe Thanksgiving, and remember to wear your mask, remember to wash your hands, remember to pay attention to all of our governor's executive orders and recommendations regarding practicing safe social distancing policies. And let's stay safe so we can have a healthy Christmas and New Year. Without any further remarks at this time, I will pass it to Senator Blumenthal. Thank you.
Thank you so much, and thank you to the great team at Charter Oak and all of the federally qualified health centers around the state of Connecticut. They are the backbone, literally the public health backbone of this state are our federally qualified health centers. We are on the precipice of unprecedented peril and possible suffering with a second surge of this virus, but there is also hope on the horizon. The two vaccines announced with 95% efficacy already from Pfizer and Moderna have now been added with AstraZeneca with a comparable set of results. And so vaccines are on the horizon. They are ready to go once they are approved for emergency use authorization, which will happen, we hope, within days. So vaccines will be available, but not without resources, not without money, not without financial support from the federal government for sites like this one that will actually put the vaccine in people's arms. Vaccines have no effect unless they are vaccinations. They have no real effectiveness unless they are put in people's arms. A vaccine itself is useless unless it goes into someone's arms. And that's why distribution, freely, effectively, fairly, is so important. There needs to be standing up of sites for vaccinations, modernizing of data, and registry systems, training and recruiting of qualified workers, the people who will put the vaccine in people's arms, recruiting, training, modernizing data, providing the sites, and the information that will reassure people that these vaccines are safe and effective. Already we know that possibly as many as 40% or more of people in Connecticut and around the country will not take this vaccine unless they are informed and reassured. So communications is going to be very important. The estimate is that at least $10 billion is necessary for this vaccine to go from the manufacturer to the patient, from the place where it's made to people's arms. People of all ages, races, religions need this vaccine. And people ought to get it, not just people who can afford it, everybody, without charge, right away, as quickly as possible. So I am writing today, along with a number of my colleagues, asking the leadership of the United States Congress to move robust funding, $10 billion, right away on an emergency basis, even before the inaugural, so that this vaccine will be available to people across the country and in Connecticut, regardless of their means and no matter where they live. I am very hopeful that we will have action on this vaccine. That $10 billion will include money for the freezers that are necessary to store and transport the vaccine, because some of the vaccines will need to be stored and transported at minus 70 degrees Celsius. Some of them will have to be transported long distances. Some will have to be transported by specialized means. The transport and storage, the recruiting and training, the modernizing of data, all of these costs have to be covered by the federal government, because right now, communities simply lack the resources. And the state of Connecticut needs that money as well. The state of Connecticut will not succeed in vaccinating people, putting that life-saving substance in people's arms, unless it has the means to do so. So I'm very hopeful that we will move forward efficiently, effectively, fairly with this vaccine, with the money, at least $10 billion, that I am asking today the leadership to provide. This letter is led by my colleague from New Jersey, Senator Cory Booker. Both Senator Murphy and I are joining it, and I'm very hopeful that it will see results, because, as you know, this vaccine doesn't discriminate between red and blue states. It doesn't play favorites politically, nor should the vaccine. This vaccine should go to everyone, regardless of their means, regardless of their politics. And that's why I hope we'll have a bipartisan effort in support of robust funding, $10 billion at a minimum, for this vaccine to be provided. And now I'm very honored to introduce the mayor of the city of Hartford, who has been a great champion of public health, of the testing here, as well as vaccine development, Mayor Luke Bronin.
Thank you so much, Senator Blumenthal, and thank you to Nichelle Mullins and the entire team at Charter Oak Health Center. Senator, thank you so much for your leadership on this issue, for you and your colleagues pushing this issue now aggressively and shining a light on the fact that, as heartened as we all are by the progress in developing a vaccine, that progress will not mean anything until we've also built the system to distribute that vaccine. And that work has to start now. It can't start on January 20th. It needs to start now. And so, Senator, thank you so much for your leadership on this issue and in so many other issues down in Washington, to make sure that the federal government gets back in the game. We need Mitch McConnell and the Republican caucus to recognize the urgency of this moment. And we're so grateful to you and to Senator Murphy for pushing as hard as you are on our behalf. It's appropriate that we're having this press conference here at Charter Oak Health Center, which is one of our FQHCs, our federally qualified health centers. They have been integral to the testing effort here in the city of Hartford. Every single day, Charter Oak has been out there at different mobile sites helping to get people tested. And testing is obviously a very important piece of the puzzle. But we are all eager for that day when we can protect ourselves, protect those we love, protect our communities against this virus. And again, it is great news that multiple drug companies have made tremendous progress in developing that vaccine. But at the same time, we need a federal government that is doing the work of funding and building a distribution system at the local level so that cities and towns like ours can actually get the vaccine to our residents, can get the vaccine to those we need to protect. So, Senator, thank you so much for pushing. And I think it's important to say that this is also tied in to the bigger issue of the transition. We need the Trump administration to acknowledge that they will not be there on January 20th. And that they need to work hand in hand with the incoming Biden administration so that the incoming administration is prepared to hit the ground running and doesn't have to waste time and put lives at risk because of the lack of an effective transition. And I know, Senator, you've been a strong advocate for that as well. So thank you again. Thanks to the team at Charter Oak Health Center. And Senator, we're grateful for all of your advocacy and leadership down there in Washington.
Thank you. I think the mayor really makes a key point about the transition. Between now and January 20th, thousands of lives will be lost needlessly unless we put this vaccine into people's arms right away. That's why the infrastructure, the trucks, the freezers, the trained workers, the modernized data, the education materials, they all are needed right now. We will lose lives, literally, between now and January 20th if the Trump administration fails to support this kind of effort and if Mitch McConnell blocks it. So that's why this effort is so urgent and why we're writing today to the leadership of the Congress. Any questions?
I have one question for you, Nichelle. So getting the funding that you need for this effort to work is one thing. Getting people to get vaccinated is another. I live in this neighborhood. You work in this neighborhood. I wonder what your direct message is to our neighbors, to the people of Connecticut about, in fact, rolling up your sleeve or wherever it's being administered and actually getting the vaccine. What do you say to people who are nervous or apprehensive about doing that once you have it in hand?
Oh, very good question. So it has been a major discussion with the advisory group that we have to acknowledge everyone's fears, their apprehensions, whatever hesitancy they have. I know the Hartford Health Director, Liani Arroyo, is conducting vaccine groups where she's talking to residents in the city to determine what they need in order to feel safe to take the vaccine. So those focus groups are important. Listening to people is very, very important. So there are 3 subcommittees: the allocation subcommittee, the scientific subcommittee, and the communications subcommittee. And once the scientific committee gives the green light and confirms the integrity of the approval process, then the allocation subcommittee can say, these are the individuals who we believe should be prioritized for receiving the vaccine within the CDC framework. And the communications subcommittee will work to address anyone's apprehensions, fears, or misbeliefs, or any erroneous information that has been put out on social media or any other news channel or distribution method, because we all know that there are incorrect stories, incorrect information. So that communications subcommittee is going to work to address each community and just bring true information, facts, whether it's from a scientific or CDC perspective, but also the hows, the who's, the what's, the where's, the when's, and what they can expect when they sign up or when they arrive to a clinic or their provider to receive a vaccine.
So where are you as a mom? Are you ready to do this? Are you ready to get vaccinated? Are you ready to have your kids vaccinated?
As a mom, right now, no. And I can tell you, I say no because we don't even have, the FDA hasn't approved anything, and our scientific subcommittee has not given us the green light. Now, once I have more information, I can sit down and have a conversation with my husband and my children about that to determine how they feel about the vaccine. But as of today, Monday, November 23rd, I can say no, only because of those reasons. We don't have a cleared vaccine on the market right now. So I think it would be premature for me to say that I would be ready to get a vaccine today, and I would not advise anyone else to do that today, seeing as though the FDA has not approved it.
I think that's a really, that's a really smart answer. Because we're going to have the FDA reviewing this data exhaustively over the next few days. Obviously, they're going to expedite the review, but the emergency use authorization, the EUA that will clear this vaccine, has yet to be issued. And the FDA is going to hold accountable Pfizer, Moderna, AstraZeneca, Johnson & Johnson, all the vaccine makers. And let me add just one more point, because your question is really important. We're already seeing a disinformation campaign. We're already seeing efforts to discourage people from getting this vaccine. A vaccine that works not only protects you, but it also protects your family, it protects everybody living in the city, everybody living in the country eventually. So we need to have the resources to combat any disinformation campaign that may be out there on the internet, just as there was before the election, spreading misinformation and making sure that people have the confidence they need and deserve. And people are right to ask questions. They should ask questions. And the federal government's going to have answers, persuasive answers, that will allow the moms and dads, and I'm one of them, to say to their kids, it's okay. And that's the kind of confidence building that we need to finance and invest in doing.
Maybe one more question for you, Nichelle. Where are you as a health center about the idea of being called upon to administer a vaccine? Are you excited about it? Are you nervous about it? Are you ready to do this? What do you need to make this run smoothly? We're hearing for a lot of money, but what is it that you folks need?
Well, one, we need the FDA to approve it. So that's the first thing, but definitely we will need funding to help with the distribution. Just like with testing, we foresee that once the public feels comfortable with the vaccine, people will be lining up for it. And very much like the flu vaccine, there has been reports of shortages. And so we have a lot of people calling and asking for the flu vaccine, and we have to find it. So we'll need resources in terms of funding, but we'll also need more staff to help us to administer the vaccine. And let me just say, it's a very individual choice. And we have to respect and honor people's individual choices. And to the extent that we can provide comfort around the vaccine in terms of the safety and the efficacy of it, it's our obligation as healthcare providers to do that, and also to provide education to individuals so that they feel comfortable taking the vaccine for themselves and for their children.
And I should just emphasize, there are no plans, there are no intentions to make this vaccine mandatory. I'm sometimes asked, is there going to be some kind of law passed that you have to do it? No more than we do the flu. But obviously, the flu vaccine helps everybody to stay healthy because it ends the spread. So I think people have a responsibility not just to themselves, but to their families, to everybody they live around. And I really want to thank again all of your team, because you do such great work. I've been here countless occasions when I've seen the flu vaccine, all kinds of public health needs answered, and Charter Oak and all the federal qualified health centers do absolutely spectacular work. So thank you. Any other questions?
Can I add one thing?
Yeah, sure.
Just to the question of the readiness of the vaccine right now. I think it's just really important to stress again that the work is continuing on the vaccine. The trials are continuing. The tests are continuing. The approvals are pending. They have not yet been granted. But it's during this period when the vaccine is not yet ready that we have to prepare for the time when the vaccine is ready. And that includes not just the massive logistical challenge of distributing millions of doses of a vaccine, potentially at very low temperatures, but also the on-the-ground work in communities that Charter Oak Health Center and our hospitals and our other FQHCs have been doing on the testing front. You're going to need a similar effort, a mass mobilization of trusted partners in communities all across the country to make sure that this distribution is effective. And we need to start that effort, not piecemeal, but on a nationwide, coordinated, well-funded basis now, regardless of which administration is in, regardless of where the vaccine is in the trials. The preparation for the distribution at every level has to start now, and that's why what our senators are calling for, what Senator Blumenthal is so strongly calling for today, is so vitally important.
Thank you, everyone.